Hello, friends. Today I will be discussing the disease dengue. The best way to stay healthy is to educate yourself and practice good hygiene. I would like to share information about dengue fever and encourage everyone to keep practicing good hygiene. If you or a family member think that you may have symptoms of this disease, please seek help from a licensed healthcare provider. I'll be sharing information about dengue under the following topics: classification, morphology, pathogenesis, diagnosis, treatment, prevention, and control. So dengue, its common name is dengue fever or breakbone fever. It's from the family Flaviviridae, and the genus is Flavivirus. Now I'll be discussing its morphology. The virus has the presence of an envelope. It is a positive single-strand virus. It is also an RNA virus. Its nucleocapsid is icosahedral symmetry, and it replicates in the cytoplasm. This morphology information is primarily for health science students who may be tested on its morphology. Next, I'll be discussing its pathogenesis. Now, first, I'll talk about the epidemiology. The geographic distribution of dengue fever or breakbone fever is a viral infection spread by mosquitoes that predominantly thrive in tropical and subtropical regions. When I was growing up, I often heard about someone who was infected with dengue, and I remember always listening to the radio or watching on television whenever they discussed the dengue fever outbreak in the island. As most of you who follow my channel know that I grew up in Jamaica, dengue fever was a common disease that affected many people in Jamaica. Dengue is a viral infection spread by mosquitoes that predominantly thrive in tropical and subtropical regions. The disease is caused by any of the four closely related dengue viruses, which are transmitted to humans by the bite of an infected mosquito. Transmission. The disease is caused by any of the four closely related dengue viruses, which are transmitted to humans by the bite of an infected mosquito from the species Aedes aegypti. Symptoms. The dengue fever is characterized by flu-like symptoms that can range from mild to severe. The symptoms usually start 4 to 10 days after being bitten by a mosquito. The symptoms include a high fever of 104 degrees Fahrenheit or 40 degrees Celsius, headache, nausea and vomiting, muscle and joint pain, backache, and skin rash. In some cases, dengue can lead to a more severe form of the disease known as dengue hemorrhagic fever, which can cause bleeding. This happens because the blood vessels become weak and break inside the body, which leads to internal bleeding. There is also low levels of blood platelets, which is known as thrombocytopenia, widespread infection resulting in very low blood pressure, which is septic shock, and even death. Now I'll discuss diagnostic methods. The methods used to diagnose dengue include doing serology methods like ELISA, which means enzyme-linked immunosorbent assay, or a viral culture can also be done. Prevention. Prevention includes measures such as using mosquito repellent, wearing long sleeve clothing, and removing standing water where mosquitoes can breed. For further information, you may go to the CDC website. I also like to go to the Mayo Clinic website, and these websites give you very up-to-date information about dengue fever as well as other diseases. Thank you for watching my presentation, and I will see you in the next video.